So we'll quickly look at the next concept, and this is what is known as what aromatase deficiency. So of course, if you want to break down this whole concept down, anytime you see A's like this, of course you are talking about an enzyme. Okay, now if you say there's a deficiency of that enzyme, for you to know, the effect, you must have known the use of that enzyme. Do you understand? So for the aromatase enzyme, all right, this could be how somebody that has an aromatase deficiency will look like. All right, so quickly moving to the next concept. So just so you know, it's a rare genetic condition. Okay, so it's disrupting the body's ability to be able to produce estrogen. Do you understand? So this will now take us to this table, where you have what aromatase is a very important enzyme in converting what androstenedione to estrogen, also converting what testosterone to estradiol. All of them actually form estrogen. So if somebody lacks this enzyme, the person is what lacking estrogen. Do you understand? So estrogen, of course, is a key hormone, is very important for what the females. Yes, you can find it in males, but the levels are small. Do you understand? It's mostly important to females, right? So if there's a deficiency in aromatase enzyme, it's usually caused by what mutation in an enzyme and in a gene known as what CYP19A1. All right, so the enzyme is the enzyme that actually forms aromatase. The gene is the gene that forms aromatase. So key features: low estrogen, high androgens. Of course, if estrogen is low, most of the times androgen levels will be high. You understand? So it leads to a range of symptoms, all right, in both males and females. Okay, so you have what the females having very big genitals. All right, so there's delayed puberty. All right, there's a tall stature. You can see that tall stature. Okay, then osteoporosis, that means their bones are very weak and fragile. You understand? Virilization in pregnant mothers. Okay, so in males, that's like basically in females, right? So in males, you'll be having like it will not really affect the males. This is because males don't really need estrogen that much. Do you understand? But it can include them having what low desire for sex, then their sperm production is not going on as planned, undescended testes, risks of type 1 diabetes, their insulin levels are going so high, fatty liver. So diagnosis and treatment is, first of all, that if aromatase is deficient, a particular hormone levels will be low. So you just try to check out for estrogen levels to see if estrogen levels are low. Okay, so treatment is very simple. Such a person is lacking estrogen, so you are trying to replace estrogen to that fellow. You understand? So this is just it about the aromatase deficiency as a hormone disease.